Dr. Uché Blackstock is on a mission to fight bias and systemic racism in healthcare. Dr. Blackstock graduated from Harvard Medical School in 2005, going on to become an ER doctor and professor of medicine at NYU. She and her twin sister, also a doctor, Oni Blackstock, followed in the footsteps of their mother, Dr. Gayle Blackstock, who graduated from Harvard Medical School nearly 30 years earlier. Dr. Uché Blackstock's new memoir is named Legacy. A Black physician reckons with racism in medicine. She reflects on the challenges that she faced and the deep racial inequities in the U.S. medical system. Dr. Blackstock, we're very happy to say, joins us first on CBS Mornings. We are so glad to have you here.
So much for
I think this book should be required reading for all medical students, Black and white. It is so good, the way you take us on this journey. It was jaw-dropping, it was painful, it was very revelatory. But I want to just backtrack for a second about your mom, who died before the age of 50 back in 1997. And even as we sit here today, she had blood cancer. You still wonder if the fact that she was Black might have contributed to her death. Why?
Yeah, Gayle, thank you so much for having me here today. I think about it because my mother was born into poverty. She suffered from racism very, very early in her life. And she also took great care of herself.
Mm-hmm.
She ate well.
She was a runner?
She was a runner. She ran every day. She ate well. She was intentionally very careful about her health. And even despite all of that, she died so early, was diagnosed at 46, died at 47 from leukemia. And we know that that is consistent with the statistics that we have in this country where Black people overall, we have a shorter life expectancy.
Yeah.
And that's not because of anything inherently wrong with us.
Yeah, Black men in particular, you said, have the shortest life expectancy. But you're now on a mission to point some of this out. Can you help us understand, because we've always been, we've been told Black people have a higher tolerance to pain, that our skin is thicker. Can you just set the record straight about the biological differences between Blacks and white?
And I have to say that a lot of those beliefs are deeply rooted in the history of this country. They are deeply rooted myths about the differences between Black people and other people used to justify chattel slavery, right? Used to justify Jim Crow, used to justify us being treated differently from each other. But the fact is that race is a social construct, right? But what also is a social construct is racism, but it's the impact of racism on our lived experience every day, where we live, work, pray. That impacts our health.
But there are no differences between Black bodies and white bodies.
No, there are no biological differences, but there are differences in how we are treated.
And you write about how those myths are perpetuated in the medical field. And you said that it was your experience as a patient that really opened your eyes.
Yeah, it wasn't until I was a patient in medical school, my first year of medical school, where I developed really bad abdominal pain. I went to the emergency room. It took 3 ER visits for me to be properly diagnosed with appendicitis.
Wow.
But during those visits, I was questioned about my sexual activity. People doubted me. Yes, and I wondered, would this have been the case if I wasn't a young Black woman? But it then ultimately ended in my appendix rupturing and I had complications. I was out of medical school for a full month.
And that could have been avoided.
And that could have been avoided. So that's the whole thing of Black folks, when we interface with the healthcare environment, often our complaints are dismissed or minimized or ignored, but what that ultimately leads to is our harm. That leads to the diagnosis being missed or delayed, and sometimes even death.
Yeah, you were lucky because your appendix actually ruptured, and that could have been prevented.
Yeah.
But give us some concrete facts about why you say there are inequities, for instance.
So, for instance, we talked about this. Black mothers are 3 to 4 times more likely to die of pregnancy-related complications than their white peers.
Even highly educated Black women.
And even myself, with a Harvard college degree and medical school degree, I'm still 5 times more likely to die in pregnancy or pregnancy-related complications than my white peers. Black men.
Why?
And so there are multiple reasons. Some because of the interactions we have in the healthcare settings where we're not taken seriously, we're ignored and dismissed. But also the weathering, this experience that we have in this country where we are placed under chronic stress dealing with everyday racism. That actually prematurely ages our bodies.
You talk about that, you call it weathering. And so the question then becomes, why are there still these inequities and these gaps in the medical field? And I want to read a statement here from Harvard Medical School because they congratulated you on your book and they say this: Dr. Blackstock's recounting of some of our own personal educational and health experiences reminds us that much more remains to be done in the medical profession as we physicians and educators work to achieve diversity and equity goals in service of our patients and in service of society as a whole. But why are these gaps still there? Why are there doctors who are still treating patients who still have some of these ideas in their mind
absolutely.
that Gayle just mentioned?
Because like medicine, or like every other discipline or social institution in our country, medicine is deeply embedded with racism, and we have to be very intentional about undoing it. So what that looks like is making sure in the classrooms that we're addressing this history, right? But we're also preparing future doctors to be able to care for diverse patient populations, that they are addressing these biases that are internalized by messaging that we have all around us, that Black people, are less human or can't feel pain as much. That manifests itself in how health professionals interact with patients, and we see that ultimately in the poor health outcomes.
You see it also in maternal mortality in this country with Black women, especially.
Yes.
Yeah, I mean, and the beauty of the book is you do a call to action. You address Black parents, white parents, the medical institutions, the government.
Right.
You really do give we don't have time to get into it, but you give a very specific call to action based on your experiences. Because this is something that can be solved and can be changed.
Right.
Oh, absolutely. And we know that it is absolutely unacceptable and that everyone has a role in making a difference so that Black people can live healthy, full lives in this country.
All right. Thank you very much, Doctor. Even the title of the book, Legacy, your mom's legacy, and then the legacy
come from
continues.
good stock.
Yeah, they come from good stock. See what he did
there?
Thank you, Dr. Uché Blackstock. We thank you. Legacy is on sale now wherever you like to buy your books.